Hello, I'm Danita Hester, one of the clinical nurse educators, and today I'm going to teach you how to use the MaxiSky Lift. So there are designated rooms on first floor MCU and patient rehab, PCU, med-surg, and an ICU that have MaxiSky Lifts, which will actually help you reposition your patient and transfer your patient using the Sky Lift. So the standard Sky Lifts in most of the rooms go up to 600 pounds. We do have two rooms, 223 and 225, that have the bariatric Sky Lifts, and they have they go up to 1,000 pounds. Okay, so typically our patients over 600 pounds would go into one of those two rooms. So the Sky Lift is on what we call an H frame, so I can just move this guy around here a little bit if I need to angle it so I get it off the charging base. I can, anywhere the frame on the ceiling is located, I can move the patient within that location, okay? So I cannot use the Sky Lift to move the patient into the bathroom, but I definitely can use it to move from bed to chair if I needed to. There is a remote on the Sky Lift that will help facilitate moving it up and down. So I'm just going to move it down here a little bit more, make it a little easier to reach. And we're just going to place it over towards our patient here that we're going to reposition. So underneath Miranda is this white sheet with the blue handles. This is actually a repositioning sheet. It can be used to change the linens on the bed. You can just lift the patient high enough to move the linens or change the linens. It can be used to boost her up in bed or used to reposition her from side to side. Okay, so we're going to go ahead and just lower this down. I want the narrow ends. You'll notice that there's two different lengths. There's a wide length and a narrow length, and the narrow end goes towards the shoulders. Okay, so we're going to get this down. And you want it centered over the patient's mid-body. That will make it just a little bit easier to get your loops hooked on. So there are 3 levels of loops. There's blue, gray, white. Part of it is just going to depend on the size of your patient, the location of your patient in the bed. We're going to go ahead and go with white today. So the 3 bottom straps are going to go on the lower bar here and hook in. And then our upper 3 straps will go on towards the top strap or top bar. Okay, one tip, you want to make sure that you leave the patient's pillow in place, otherwise their head is going to flop back a little bit. Another tip that you can do is just to kind of lift their heels so it doesn't bend them in half like this. The thing that you want to do with that is if you're moving them in the bed is to be careful that you're not dragging their heels on the surface of the bed, as this can cause a shearing injury. Okay, so now we're just going to go ahead and lift our patient here. So we have the remote with an up and down, so we're just going to hit the up button. And we're just going to lift our patient off the bed. Okay. All right, and just enough for their bottom to clear the surface. You don't want to get them too high. Now we can move our patient side to side. We can move her up and down. So we're going to move her up a little bit. We're going to reposition her onto her left side. And then be careful not to get too high there. Okay, and now we're just going to go ahead and lower her down. All right, a really cool technique that you can do here at this point is just to go ahead and unhook one side of your repositioning sheet. And then we're going to raise her back up and we're going to turn her onto her side without any strain or stress on our shoulders or backs. So you'll notice now that Miranda is going to start to turn onto her left side. At this point, Barb could go ahead and put some pillows behind her back, and then when we lean her back, she'll be right against those pillows. There are 2 slings that go with the MaxiSky. This is a repositioning sheet. This is a disposable sheet. It can be left underneath the patient unless it gets soiled. If it gets soiled, it does need to be thrown away and replaced with another one. If you have a patient that's involuntary or incontinent on a regular basis, you're probably not going to want to leave this underneath them, just because if you're throwing 2 or 3 of these away a day, that's not very ideal or cost efficient. The other type of sling we have is the regular sling that also goes with the MaxiMove. The difference between the MaxiMove sling and the Skylift sling is the Skylift sling actually has the loops like the repositioning sheet. The MaxiMove sling has the little clips, and we'll show those, showing those to you in a separate video. If you have any questions about how to use the MaxiSky, one of the resource nurses should be able to help you. You can also contact one of the educators by calling extension 4000. Thank you.